Welcome to Healthbeat, our first show of 2024. I'm Mia Malan. Today we're going to talk about sleep disorders and how closely they link to our health, mental and physical. The amount of sleep we get can affect conditions like HIV and diabetes. For instance, people with HIV who don't sleep well have been shown to adhere less well to their treatment. And those who suffer from sleep problems are more likely than sound sleepers to be depressed. With me in the studio are two wide-awake sleep experts, Dr. Alison Bentley and Dr. Nomathemba Chandiwana from the Restonic Essentia Sleep Clinic at Wits University. A warm welcome to you both. Thank you very much for joining us today. Alison, let's start with you. How many hours of sleep should we have per night, or is it different for each person?
What's key about sleep is that you have to get enough sleep for you. And enough sleep, the whole point of sleep is to make you ready for the next day. If you get however many hours you get and you are fine the rest of the day, you're not sleepy, you function well, you're not tired, then you're getting enough sleep. That's really the answer. So it's more about daytime function than it is hours of sleep. The two big sleep disorders is quantity and quality of sleep. So it is about the number of hours you get, but then for those hours, they need to be good quality sleep. So if you get poor quality sleep, you might be sleeping 7-8 hours. But if you wake up in the morning and you feel exhausted and then you feel tired during the day, there's still something wrong with your sleep.
You've mentioned sleep disorders now. So how many of them do you get and how do you diagnose them?
There's 85, 100 different sleep disorders, some of them extremely rare. And some of them are subsets of others, so you might start off with sleep apnea, and under that there's about 8 different types of sleep apnea.
So the most common ones, what would those be?
One is insomnia, which is not getting enough hours of sleep. The other one is hypersomnia, and that's getting the hours, but feeling sleepy during the day. And I mean, we're talking about sleeping in meetings, sleeping in front of the TV, sleeping while driving, so that kind of really excessive sleepiness during the day. And the last one is parasomnias, which is kind of the weird things that happen in the middle of the night. Sleepwalking, sleep talking, that kind of thing. Those are the 3 big groups.
Nomathemba, you are associated with Essentia, which is a HIV clinic. Why did you start a sleep clinic? How do the two relate to each other?
It's an unusual pairing, but sleep disorders affect all different populations, including people living with HIV, what our institute Essentia is known for. So this pairing together with the Restonic Essentia Sleep Clinic and Alison, top sleep expert in the country and who's taught us a lot about sleep. That's how the pairing came together, because in one of our big trials, we're seeing people that weren't sleeping well. These were people who were living with HIV.
Why does HIV affect sleep? How does it work?
It affects sleep in a number of different ways. So one, we know that people living with HIV have got a lot of added stress and are more vulnerable than the average person. If you look in our country, we know the poverty levels that people are concerned about, the stress, and also stigma related to sleep. But that's not only that, some of the medications themselves can cause disruptions with your sleep. They can cause you to not sleep enough or sleep too much. And also HIV itself, for reasons that we don't quite understand, sleep itself affects your circadian rhythms and how you sleep.
So just to get back to the medications, are you talking about antiretroviral treatment?
Right? Yes. So some of the older antiretroviral treatment, efavirenz being the one that we used before, that really did affect people's sleep. So we wouldn't give it to people who were shift workers, for example. What we have currently, though not as much, which is called TLD, can cause some insomnia. So it's a combination of things. It could be personal things to do with yourself, it could be your aging, the treatment that you're on, and people living with HIV could have other diseases as well that affect their sleep. Commonly in our country, we're looking at obesity, type 2 diabetes, all these things together with the environment that we're in. We're worried about our safety, where there's load shedding that wakes us up. All those things together affect our sleep.
Now, Alison, if you have diabetes and it affects your sleep, why does it do it? How does it work? What's the medical reason behind it?
Firstly, part of the reason why you get type 2 diabetes is often obesity, that you put on weight. And that weight will increase your risk of sleep apnea. And so that's going to be part of it. But as complications of diabetes, you can get nerve damage in the legs, and that can give you restless leg syndrome and periodic limb movements at night. And then you can have insomnia because you just are living in the stressful environment that everyone else is. If you get depression, you're more likely to have a sleep disorder. This kind of weight relationship between sleep and weight is very interesting. So if you don't get enough sleep, the studies show you're more likely to be overweight just because you don't get enough sleep. So if you don't get enough sleep and then you're a bit overweight and then you get type 2 diabetes and then you put on weight a little bit more and then you get sleep apnea. But I'll give you some numbers. I mean, patients who have type 2 diabetes, about 60% of them are likely to have sleep apnea. Patients are more likely to have sleep apnea if you have cardiac disease. If you have depression, more likely to have a sleep disorder. So there's many other chronic conditions where we see all of these sleep disorders, the prevalence actually getting higher within these disorders. So it's a really important combination.
And why would you get fat if you don't sleep well?
The relationship with weight is that you get woken up hundreds of times a night. You're going to wake up tired. You're going to be tired during the day. You're going to avoid exercise. You're going to calorie hunt. You're going to put on weight.
And added to that, some of the hormones that replenish whilst you sleep, leptin and ghrelin, they are not doing their job because you're not sleeping well.
After the break, we'll speak further to Dr. Alison Bentley and Dr. Nomathemba Chandiwana of the Restonic Essentia Sleep Clinic at Wits University. This is Healthbeat. I'm Mia Malan. We're focusing on sleep and good health. Sleep disorders can range from sleepwalking, not being able to sleep at all, or finding it hard to stay awake for long periods of time. Before we chat further to our sleep experts, let's watch this insert.
I started getting very tired, but thinking that you're getting older, I thought, oh, it's normal.
Pretoria grandmother and trained sleep nurse Granita Harold used to need energy drinks just to get through her day.
I started living on power drinks. I will take a power drink 5 o'clock in the afternoon before I go and see patients at hospitals. By 10 o'clock, I will fall asleep.
Even though she worked for a company that helped patients with sleep apnea, the penny didn't really drop for Juanita. The lack of sleep also affected her mood.
You are tired, you're irritated, you don't lose weight. I was actually a horrible person at that stage. I snapped at everyone, and I'm not a fighting type of person.
She only got a hint that something was wrong when she was on vacation.
10 years ago, we went for a visit to Namibia, and my youngest daughter went with us, and she woke me up once or twice and looked over me and said to me, "Mama, you are snoring me awake."
After the trip, her husband began noticing that she sometimes stopped breathing at night.
So one evening, I did test myself, and I've got severe sleep apnea. I stopped breathing for more than 42 times in an hour, and one or two were longer than a minute.
Sleep apnea is when you stop breathing for periods while asleep. Juanita realized that her weight problems and grumpiness were connected to this.
I think there is much more people that do suffer from sleep apnea than we realize.
Boniface Chiep is a specialist neurologist who runs a sleep clinic in Sandton.
In the beginning, people didn't really realize that most of their problems had a sleep, undertone. Many people came in with headaches, they came in with epilepsies, they came in with fatigue. For them, it's life or death. They come in because either their partners have left the room, they're snoring a lot, and or they themselves are finding life, it's actually, you wake up sweating, you almost died.
10 minutes.
Researchers say insomnia affects about 7% of South Africans, over 4 million people. And about 1 in 5 adults suffer from sleep apnea.
your cardiometabolic system, respiratory system goes haywire. Your blood pressure is shooting up, your pulse is shooting up. That's when a lot of people have had heart attacks at night or strokes and stuff like that.
Juanita now gets a good night's sleep, thanks to her CPAP machine.
Put my mask on.
What the machine does, it takes the air that you normally breathe in your bedroom or where you're going to use it, takes the air that you breathe in, pull it through filters, then it forces it into your airways to keep your airway open. So that is what CPAP stands for, continuous positive airway pressure.
Since wearing the machine, her overall health has improved. And she's lost some weight.
So since 2019, when I started the CPAP treatment, I've lost 31 kgs already, and I'm still going strong, and I'm not on a real specific diet or anything. So my life has totally changed after starting with CPAP therapy. It takes a while to get used to it, but your CPAP machine is your best friend.
Nomathemba, in the insert that we played, we heard about sleep apnea. How do you treat that? And how do you diagnose it?
So sleep apnea can be diagnosed. The gold standard is what we call polysomnogram, which is an overnight sleep study. It can also be a home sleep apnea test, which is a screening test. And some of our apps on our phones or our watches do give us some rough information. So that's how you diagnose it. And sleep apnea is interesting. It's very common as we age, as we gain weight, and associated with certain medications, for example. The gold standard is something that we call CPAP, which is positive airway that goes into your throat and keeps it open, so you're getting enough air and you're moving air at night. However, that's extremely expensive, especially in South Africa, where I think one of our ethos is that sleep medicine should not be elitist medicine. 80% of our population does not have access to things such as CPAP. So we're also looking at other low-tech or less expensive ways of treating sleep apnea. So some things could be positional therapy, putting a spiky golf ball so that if you sleep on your back, you're able to move. Some could be mandibular devices. There's some things that are available at your pharmacy, or it could be with your dentist, for example, that can give you a mandibular device to help you with sleep apnea. And if there is a surgical reason that you have sleep apnea, mostly in children, you would have a tonsillectomy and getting their adenoids out, because sleep apnea does affect children as well.
Alison, we have spoken about cost now. Nomathemba mentioned that. What about the public sector? If you have a sleep disorder, can you be helped in the public sector?
Not routinely, no. I mean, there are isolated sleep labs in South Africa that are based within the public sector, but in neurology, for example, and pulmonology. So part of our problem is that doctors come out of medical school never ever really engaging with sleep and sleep disorders at all, whether they're undergraduate or postgraduates. So they don't see a sleep lab, they don't see patients that have sleep problems. Well, they do see patients with sleep problems, they just don't know they have sleep problems because they're not asking those kind of questions. So part of what we're going to be doing is research in those populations, as Nomathemba said, to try and find ways to treat sleep apnea without needing a CPAP machine. And do we manage to bring patients from severe apnea to mild apnea, for example, which takes them out of that danger zone. So it's about doing that. It's about training doctors so that doctors learn more about sleep apnea.
Nomathemba, lastly, young people. You've spoken about older people who have sleep disorders. Do teenagers and young people have sleep problems?
They certainly do. So children and teenagers are not sleeping enough. If you think of the recommended sleep, we need less sleep as we grow. But you'll find with extracurricular activities and technology, for example, people are not sleeping enough. So particularly older adolescents and teenagers are sleeping with their phones and their iPads, or they have TV in their rooms, they're on TikTok and so forth, and that really interferes with sleep. And also the stress that young people are going through, and if you don't get enough sleep, you're not doing as well at school, you're more likely to have suicidal ideations. So sleep is important for children and adolescents.
Alison, so what do you do if your teenager can't sleep?
Well, one of the big sleep disorders that teenagers get is called delayed sleep phase syndrome. And it's not unique to that age group, but honestly, if I get a young male coming to see me, I go, I pretty much know what you've got before you open your mouth. So delayed sleep phase syndrome is like a social jet lag. And so the sleep phase, which is where it is time-wise, gets shifted. So if you think of young adolescent males during the school holidays, staying up gaming till 2 o'clock in the morning, sleeping till 11 in the morning, and then suddenly school starts again and they have to get up at 6, but they're stuck. They're stuck in this 2 till 11 kind of time zone and they can't pop back. A lot of them pop back, but then some of them can't pop back. And now they can only fall asleep at 2 in the morning and they're getting up at 6:30. So that's a very common thing. And we use melatonin and a program to kind of get them back, like you would if you traveled somewhere, get them back into the right time zone so that they're able to sleep at the right time. So that's a very common sleep disorder in that age group, and it can be treated.
Alison and Nomathemba, thanks so much for your time today and for sharing your expertise. After the break, we go to Dr. Hugh Salsick in the UK, who is a South African doctor based there as a sleep disorder specialist. This is Healthbeat. I'm Mia Malan, and we're focusing on sleep and its links to our health. Sleep disorders can be caused by hormonal changes, the medicine we take, artificial lighting, and digital devices. But South African Dr. Hugh Salsick, who practices in the UK, says insomnia isn't a symptom of another issue, but a disorder on its own. Mohali Malloy spoke to him.
What's the first thing you do to help patients who are suffering from sleep disorders?
Our first line treatment is to do something called cognitive behavior therapy for insomnia, or CBTI, which is a very simple but highly effective set of techniques that we teach patients to optimize their sleep habits, to reduce anxiety at night, and so on.
So are you saying CBT can help us train to sleep better?
Absolutely, 100%. And it's very specific CBT, and it does teach you how it changes the way you think about things, but actually it also harnesses your innate physiological sleep drives to optimize your sleep. It's a bit like a sleep class, and some of the techniques we'll deliver to patients, for example, might be to get them to get up at the same time every day, to rise at the same time every morning, because that anchors the body clock and makes their sleep time more consistent. We somewhat counterintuitively get them to go to bed later, because often people with insomnia spend a lot of time in bed and they're spending a lot of the time in the bed awake, which makes the insomnia worse. So we reduce their time in bed, much more closely match their actual time asleep, and that helps to consolidate the sleep better and give them a much better quality of sleep. And then we will look at ways of managing anxiety, relaxation techniques, ways of quietening the mind down at night, and various other interventions.
I know you wrote a book called Sleep Disorders in Psychiatric Patients. Is there principles about sleep that we all need to apply, and how do they affect our mental health?
So good sleep is absolutely central to good mental health, and pretty much every sleep disorder has a relationship with psychiatric illness. And just looking at the example of insomnia again, insomnia is possibly the biggest modifiable risk factor for depression. But actually what the research shows is that it's much more likely that the insomnia is what's caused the depression in the first place. So we can potentially treat a patient's sleep disorder and their psychiatric condition with a single intervention, and that can be much more resource efficient.
I read an article about you in The Guardian that kind of spoke about you having found a cure. Is that even, what does that look like, and how is it possible?
I think they may have overstated it to some extent. I mean, the cognitive behavior therapy for insomnia, as I say, it's really well established. There's a huge body of evidence that it works. It's been tested in different cultures, age groups, people with other comorbid conditions, and around 70 to 80% of people will get significantly better using these techniques. And of those who respond, about half will go into complete remission, will essentially be cured. And I think this is probably the difference. So the biggest difference between the CBT and medication is that medication can sometimes be incredibly effective, but it's only effective for as long as you're taking it. And once you stop taking the medication, the insomnia is going to return. Whereas with the CBT, when you use the principles, the effects are long lasting and can be lifelong.
What are you seeing over there that's keeping people awake, or what kind of conditions are people dealing with versus what you found here at home in South Africa?
So actually, I think things are very similar, more similar than you might imagine for people in the UK and South Africa. And very often, what sets an insomnia episode off is going to be stress, bereavement, work problems, financial problems, an illness. What then happens is that people react to that initial bout of insomnia in various ways, and if unfortunately the way they react is the wrong way, it actually makes the insomnia worse. It doesn't really matter if you're dealing with the stress of load shedding or if you're dealing with stress of Brexit. Actually, the way that manifests is very much the same, and the way that it's perpetuated is very much the same, and therefore the way we treat it can be very similar as well. The other thing that's a really big issue is that there's just so little education about sleep. Health departments the world over tell us how to eat healthily, how much exercise we should get, what a sensible amount of alcohol is to drink, but no one ever teaches you how to sleep. It's just assumed you're born with this knowledge, and to some extent we are, but when things go wrong, we do actually need some guidance on how to make things right again, and unfortunately that information is not really out there.
Dr. Hugh Salsick, thank you so much for your time today.
That's Healthbeat. We wish you well for a year of restful nights and focused days.